Welcome to the podcast series, Ascendem, brought to you by Heidelberg University's Graduate School for Humanities and Social Sciences. Tune in for thought-provoking interviews with experts in different fields, from the social sciences to the humanities, from law to economics. Hello and welcome to the HGGS podcast series, Ascendem. Today, we have two important guests from the Division for Policy and Implementation Research for Cancer Prevention at the German Cancer Research Center, Deutsches Krebsforschungszentrum. First of all, we have Professor Dr. Connie Hoe, Division Head for Policy and Implementation Research for Cancer Prevention at the German Cancer Research Center. Welcome, Professor.
Thank you very much for having me here today.
And second of all, we have Ezgi Baltacı, researcher and team member at the Division of Policy and Implementation Research for Cancer Prevention at the German Cancer Research Center, also in German Deutsches Krebsforschungszentrum. Welcome, Ezgi.
Hi all. Thank you for having me.
And today our topic is, first of all, we are going to talk about the concept of citizen science. And then in specifics, we are going to talk about the project of mapping tobacco and alcohol retail in Mannheim. So traditionally, we start with asking our guests about their academic background. And Professor Hoe, would you like to start with explaining briefly your academic background?
Sure, absolutely. So thank you so much again for inviting us to join this podcast. So I actually have quite a diverse background. I received my bachelor's in psychology in the U.S. And then my master's actually in macro social work. So we did community level social work and social policy. And then I have my PhD in public health, specifically in global health. So I worked a lot in low and middle income countries such as Ukraine, Turkey, Philippines, India, etc. And the specific global health topic that I focus on was health policy.
All right. Thank you, Professor. And Ezgi?
I also have a long plot twist during my career. I started as a dentist, specifically pediatric dentistry. I did my bachelor in Istanbul and did my training in pediatric dentistry in Trabzon in a rural area. And then I worked at private clinics, public hospitals, and then switched to academia in Edirne, the most western part of Turkey. I'm telling this because I saw most of the aspects of healthcare system in Turkey. And pediatric dentistry always related to prevention. Most of the oral health diseases are preventable and behavior related, right? And one day I felt stuck and I realized I don't have enough tools to go further and switched to the public health with the master's degree in international health in Heidelberg University. That's where I met Connie. I switched the health policies in specifically tobacco control policies. And then I'm now interested in implementation research and health policies.
Yeah, thank you so much, both of you. So as we have the head of the department and also an enthusiastic member of the department, I would like to ask you the activities of the Division Policy and Implementation Research Center for Prevention. As far as I understand, you are also dealing with many different areas like policy and implementation research, migrant health, and science communication. So would you like to elaborate more on these areas and what are the current activities of the Division for Policy and Implementation Research for Cancer Prevention?
Yes, absolutely. So our division is actually quite a new one at DKFZ. So we started July of last year. And our mission really is to bridge the gap between evidence and policy and practice. Because so we know from being in the field and science that we have a lot of great evidence. We know a lot about the evidence-based interventions, but they're not getting to the people. They're not getting into policy. So one example I can give is tobacco control. So many countries have ratified a global treaty called Framework Convention for Tobacco Control, but it does not mean that all the countries have adopted and implemented the evidence-based policies as per this treaty. Germany, for example, ranks fourth to last in Europe in terms of its adoption and implementation of evidence-based tobacco control measures. And so this is really the aim of our department, to do research in this area to ensure that evidence gets into policy and into practice.
Well, that's a really challenging topic and really important areas to work on. And maybe Ezgi, would you like to concretize more? What's your role actually in this area and in this division?
Now I'm in this safe space between masters. I have a master's degree, but not holding a PhD degree now. I work as a researcher. I'm assisting all the projects, like in this one, citizen science, stakeholder mapping and outreaching and organizing. For the others, literature reviews, writing reports and manuscripts and something like this. And for the interventions, like what's working, what's not. If they're working, how and what can we do about it? How can we disseminate more? And if it's not working, why? Is it some contextual factors or not? We're interested more of like this. Division is really diverse. Maybe you can talk about our other members.
Right. So as mentioned, so we just started and we already have quite a good-sized team, I would say, and very diverse. So we have a postdoc who has a health geography background. His name is Dr. Sisai Elemu. We also have a postdoc with a political science background, Dr. Clara Dentler, and another postdoc with a community engaged research background, Dr. Nasreen Agaberia. And then we have a clinician scientist who is a physician trained in Colombia, and he does a lot of work in digital health and telehealth, for example, and he has many projects that we're working together on in Latin America. And then, of course, we have Ezgi, who already talked about the studies that she's involved in, and we have a few other master students doing different projects. So, for example, on migrant health in Germany. So we have quite a diverse team, and that's the goal, to be interdisciplinary, but also to be transdisciplinary. So to also involve those outside of academia. And we can talk a lot more about that later.
Sure. Actually, as a follow-up question, so it seems like the interdisciplinary research plays a great role actually in your activities, what you are doing as a research in this division. So how would you also elaborate on this interdisciplinary function of this division, or what's the advantage of having so many people coming from different interdisciplinary backgrounds? So that would it be a challenging factor in your researches, or would you say that we are also getting the more advantageous parts of having this interdisciplinary background in this division?
I think that's a great question, and I think it's really advantageous. I mean, there are so many complex and difficult challenges we face in society today, including cancer. One sector, one discipline cannot do it alone, so we need to work together. Yes, of course, there's challenges because we use different lingo, but at the end of the day, there's definitely more advantages than disadvantages. Would you agree, Ezgi?
Yes, I would definitely agree. We see different parts of the problem. We see different parts of the elephant. It's a complementary thing.
And also one of the advantages of having a really interdisciplinary people in your maybe division or in the area that you are working on is having different methodologies. Maybe it's a topic itself. We cannot really count it as a methodology, but a topic because it has become a really hot topic today. I'm talking about the citizen science, and you are also engaging with the citizen science as a methodology and also maybe as a topic itself. So we'd like to move on actually on this topic. And I know that in terms of its definition, there's a great academic debate, or it's not really easy to explain the definition of the citizen science because there's a great literature on it and it can also take different shapes in different areas. So I'd like you to maybe describe how you use citizen science in your area and how we can also describe the use cases of citizen science in public health and also in policy and implementation research. And we'd like to start with you, Professor.
Sure. So I will just preface this by saying that we are also new to citizen science, but we're really, really interested in it. From our review of the literature, it seems like a lot of the citizen science work is stemming from the ecology, the environment field, and it's slowly gaining traction in public health in the area of non-communicable diseases, including cancer, for example, but not as much as in these other two fields. And like you said, there are many definitions out there. And for us, our perception is that it's a type of participatory approach. And it's the active involvement of community members, non-scientists, like traditional scientists, involved in the research process, including perhaps, depending on your citizen science project, formulating research questions or collecting data and or interpreting data. So it directly involves the people. Yeah. And I think maybe simply put, it's doing research with people rather than for people.
Yeah, I'd like to turn to Ezgi at that point because she has also a really great experience in terms of the social aspect of the citizen science. And I'd like to quote right now the 10 principles from the European Citizen Science Association in order to inform our audience about how to actually define and how to name the factors, name the principles that are playing role in the citizen science. The first one is active involvement, genuine science outcomes, mutual benefits, participation across research states, feedback to participants, acknowledgement of limitations, data quality and transparency, voluntary participation and recognition, community relevance, and inclusive and accessible. So, it seems like it's not a typical science that we are used to, right? I mean, social aspect also plays a great role when we look at these 10 principles. How would you like to maybe comment on that, Ezgi?
Public engagement is the major part of citizen science. It's not just about using people for data collection. It's about building relationship, creating a shared ownership, because most of the topics we're working on is community-related topics. And the diseases we're working on just not happening in laboratories. They're happening in neighborhoods and daily lives, daily routines, and social networks, and lived experiences. When communities are actively involved, like in these principles, they help define what real problems are, and they make sure that the questions we ask actually matter, and they're related to local reality, and they bring their insight into barriers and facilitators that we often miss. And at the end, they become advocates who can carry findings back into their communities. So, yeah.
That's a really challenging list of factors actually for the public, but it's also really important to include the society into this research project, right? And I'd like to turn to you, Professor, and how does it differ from a typical scientific research in your field? Maybe a bit more concrete examples.
Sure. So typically, I think kind of like what I was saying before, research is done for people rather than with people, right? I think this is the biggest differentiation. So traditionally, research is expert-led, it's kind of top-down, and citizens are usually, say, the survey respondent or the informant in an interview. But with citizen science, we kind of decentralize this process. And there are some projects where the citizen scientists are involved in asking a research question. What are the important issues facing our community, for example? So we decide this together. Or kind of in what we had done in our case too is involve them also in data collection. So that's another way of involving citizens and how it kind of differs from traditional research where we kind of hire data collectors, for example, to do the data collection. And I think what's really important is in this day and age where there's a lot of mistrust on evidence, citizen science really is key, is really important because you open up the research process, you make it more transparent. And this also helps build trust in how we as scientists collect data, for example, how we define research questions, how we define evidence. And so, yeah, so this is why also I would just add is a very critical component of citizen science.
Actually, that's a really great point because it's also about informing the public with including them into the research process.
Yeah, exactly.
And maybe on that point, the ethics of citizen science plays a really great role because the researchers have to include public into the research, it comes with different responsibilities. And we can also talk about the transparency requirement. The researchers have to inform the participants, and the requirements may be regarding their personal information, both the legal ones and also the ethical ones. So would you like to more elaborate on this ethics of citizen science, and how does that also play a role in terms of including the public into the research so that they can trust more into the scientific process?
Yeah, that's a great question. I think there are several things that we need to take into consideration. First, citizen science often relies on unpaid contributions. So it's essential that we also make sure, kind of like when we're doing a research study, that they know participation is voluntary, it's not coerced, expectations are reasonable. We don't create any risks to what they're doing, right? And also, like you were talking about, in relation to data protection, depending on the project, we also need to ensure that they're trained to protect, personal identifiable information if that's involved in the project. And I think reciprocity and fair benefit sharing is also really key. So if people contribute knowledge and time, they should also receive some value, like some feedback, some outcomes. Or I think for our study, we're planning a dissemination workshop, for example, to kind of show them what is the result of what they've participated in, and also to get their feedback too about what they think we should do with the data to help benefit the community. Yeah, so this is a very important aspect, and it's a great question.
Sure, actually, and there's a balance between actually informing the public about the research itself and also keeping the research also on its feet. Yeah. So yeah, it's a really challenging process. I can understand it, but as you also have experiences with the citizen science project, and also you conducted this part of this project.
I was part of this project. For example, like we did first training session in our project, and then mapping, and then feedback session, and show the citizen scientists what they did on that day. And as a thank you gift, a small token of appreciation, I felt, as far as we know, they were happy about this contribution. Like they shared their thoughts about how the retail density in Mannheim. And when they mapped, they were surprised how dense the retailers were in the ground. And I think it's a great topic for them at the end of the day when they went home to talk about their families. I think it's a small step, but for the raising awareness, I think it's a great step.
Actually, that's a great thing to hear, because what we have talked about until that point was the theories, just the things on the paper. But it's also really great to hear that it also works in the practice, so that you also felt this engagement with the public when you conduct this research. That's a great point, actually. But we already talked about only the positive aspects of the citizen science, but I'm pretty sure that there are many challenges that comes with it. So would you like to start, Professor, with naming some challenges in general that you have faced with?
Sure. I think one of the biggest challenges is recruiting citizen scientists. And actually, when we first started, we looked into the literature to see how people have done it. And we realized that there's not a lot of work in this area comparing different approaches. Should we recruit them via social media? Should we recruit them via community organizations, et cetera, et cetera? So we kind of, based on what we saw others have done, we decided to take two approach and kind of compare it. But this really is challenging, like what channel to use, on social media, for example, which community groups. So we did stakeholder mapping, for example, but how do we recruit them? I think this is the key question. Yeah.
And also one other challenge that I'd like to ask is the reliability of data and data quality. So when I researched about this citizen science, the important question about the reliability of the data actually come in front. And also I'd like to ask you, Ezgi, what are the measures that you can take actually to face with this reliability question of the data?
Yeah, I can add the challenges that it's a repetitive task, so it's a bit boring. So it decreases the data quality, and the heterogeneity of the participants and skills also another challenge. So to overcome these things, first we developed a detailed step-by-step data collection guide to make sure every tagging is standardized and consistent across all participants. And then we had a diverse approach. Like we deployed 2 trained researchers to map the entire city first to have a high quality reference data set. And afterwards, we organized a mapping day for citizen scientists. And like I said, is training session and field mapping. And then we did quality checks, both for our two researchers, randomly checking their locations they had already mapped. And then we compared the data quality between researchers and citizen scientists to see in the future, can it be a model? The citizen scientist is a reliable resource for mapping the city. And we checked consistency, agreement, and potential differences.
Actually, we talked about the skepticism of the public against the research processes. So that will be a relief maybe for the public to learn that the data that you have collected is checked really rigorously and also then used in order to conduct some results from your research. So thank you for your explanation. And to concretize this project more, this term citizen science, you also conducted a really interesting project, namely mapping tobacco and alcohol retail in Mannheim. So I'd like to start with a general question, actually. What was the general motivation behind this project and maybe specifically why tobacco and alcohol retail, Professor?
Sure. So we know that about 40% of cancer is preventable if we address some of the key modifiable risk factors. And that includes tobacco being number one as a key factor and also alcohol. And we also know that in the environment where we live, where people live, that can strongly shape health behaviors. And a lot of studies has shown that tobacco and alcohol availability and density is positively associated with higher smoking and drinking, with earlier initiation among youth, and it's also more difficult for those who smoke and drink to quit. And there's also research that shows that in other countries that tobacco and alcohol retailers are more dense in areas that are lower socioeconomic status compared to higher socioeconomic status. So environment matters, but in Germany, this type of research is very, very limited. And so that's why we were really interested in doing this in Germany, particularly since a lot of these policies on restricting access is not available in Germany. So, for example, Germany does not have a national licensing system for tobacco retailers, for example. This means any shop can sell tobacco. So there's no central database. If this existed, actually, we wouldn't have to map. We ask the government and say, can we please have this data that we can do all sorts of analysis and monitor, where the retailers are and things like that. But because we don't, that's why we need to take this quite tedious, I would say, approach where we actually walk street by street to find out where the retailers are. And so that's kind of the motivation behind this topic. And maybe I can also explain that Mannheim, we decided to choose Mannheim as our pilot for a few reasons. One, Mannheim has a very interesting demographic. It's about almost, I think, 40% people with migration status, right? And so we also wanted to see if tobacco and alcohol retailers are more dense in neighborhoods that have more migrants as compared to the neighborhoods that do not. And of course, there's also since this is kind of a pilot study, there's also a convenience factor. We're in Heidelberg and Mannheim is the city over. So that's also why. And we have done mapping of cigarette vending machine actually in Heidelberg as well. Yeah. But Mannheim is kind of our next step. Yeah.
First, we started for the pilot project with cigarette vending machines on the streets only in Heidelberg. Then we scaled up a bit for Mannheim.
Yeah.
We included tobacco and alcohol retailers, and not just on the cigarette vending machine, but all the retailers, all the shops.
Right.
You would be surprised how different kind of shop sells tobacco and alcohol about availability.
Yeah. And maybe I just add here too that we started with cigarette vending machines because according to the Framework Convention for Tobacco Control, which Germany ratified in 2004, I think, it suggested that cigarette vending machines should be banned. And it's been banned in many countries, but Germany has not. As I'm sure you've seen, they're widely available. And the reason why it should be banned is because its presence is an advertisement and promotion of cigarette. It creates this norm. It normalizes smoking. So that's why we actually started with that and then expanded.
Actually, I'm really shocked to hear these bad news and how that was actually not really good, maybe regulated. So I will also take your policy recommendations surely, but maybe in order to deep dive into the methodology behind your project, you used also citizen science as a recruitment approach in the project. And Ezgi, you briefly mentioned about this two-track approach you used, including this citizen science. So would you like to elaborate more on this topic? And how did you use this two-track approach, including, first of all, stakeholder mapping and outreach and targeted social media advertisements? But what should we understand actually under these two different steps?
First we thought who would be interested in this topic, tobacco and alcohol, behavior change, retailer density, and we aimed principles like relevance, diversity, and reach, because in terms of Mannheim, diversity is a must. In terms of citizen science, diversity is a must. Yeah. One of the principles is like avoiding tokenism, maybe. So we thought and we prioritized like cancer prevention and health-related behavior organizations who could then be national health and prevention networks and local initiatives promoting healthy lifestyles, like one of them Kinder Ohne alcohol and nicotine. And then for local and environmental engagement, we think environmental NGOs like Naturfreunde and Bund, and there was Academic Sustainable Center. We reach out those. And for institutional and patient perspective to include them, to have a patient voice, we contacted structures at the National Center for Tumor Diseases and Patient Advisory Board and self-help groups to reflect the Mannheim's diverse population. We included faith-based organizations like the organization of a mosque in Mannheim, and there's these social welfare institutions like Caritas and Diakoni. All these institutions and organizations we found from publicly available resources, and municipal web pages has these youth or civic engagement groups like Stadtjugendring or Mannheim sagt ja. I tried to reach out as many as possible, diverse groups. First, we sent bilingual invitations in this first approach. We did stakeholder mapping and sent mail explaining the project, volunteer role and benefits, and asked these organizations to share it within their networks. And then we ran an Instagram advertisement. Targeted at social media advertisements means that you can select the targeted audience or people from certain social media channels. For us, it was Instagram. And we targeted adults over 18 years of age in Mannheim, Heidelberg, Ludwigshafen. The advertisements were bilingual. We ran it through the KFZ account, Instagram account. And then we built a landing page, web page, and explained the project and sign-up processes. We assumed at that time this track would help us reach younger people and more digitally active people who might not be connected to those organizations we reached at the first place. Yeah, this was our assumptions, but we had our challenges.
Actually, I would like to ask as a follow-up question, because you used a certain app so that the participants who participated in your project actually use that app in their mapping of the Mannheim streets, right? I mean, so it also signifies that the technology and also, as you mentioned, Ezgi, social media plays a great role in the citizen science, if I interpret it correctly, maybe.
Yeah, you could say that. I think we chose to use a targeted advertisement on social media, but I think there are projects that have not done that, right? And they use other approaches to reach citizen scientists. Yeah, I think the idea is that if you use social media, targeted advertisement, you can reach population that you may not be able to reach through other mechanisms.
Sure, sure. And also the challenges part. So what were the challenges actually that you faced with specifically in this project and also with this citizen science approach that you used in this project?
Yeah, well, I think recruitment really was quite the challenge. So I think at the end, we got 7 citizen scientists to participate. We did have a vision of more. In fact, at one point we thought, wow, what if we had 100 people come? And now we're laughing because 7 is, a big difference from 100. But, so for the community outreach part, there were a couple of organizations that were quite interested. But then there was more of a logistical issue in that we needed to figure out if citizen scientists below the age of 18 can participate. And yeah, so this kind of relates to, I think, a previous question you had before about ethics and things like that. Because one of the groups was a youth group, and they
from
were
Young Bush.
Mannheim. They were really interested, but we spoke with, the different departments at DKFZ, and to be on the safe side, we decided to recruit those 18 and above. But I have later on seen projects where they involved those younger than 18. So this is something to explore further. But just as one of our obstacles, this was a little bit logistic, so they were not able to be involved.
This could be a concrete example for ethics, actually, because we were in between whether it's considered exploitation. That's why we opted out. But yeah.
Yeah, because of the Youth Employment Act and things like that. So
actually, that could be also a policy recommendation, because there should be maybe a little bit flexibility in terms of how you include the minors in your research, because it's also really beneficial to them to get them into this scientific process, actually.
And they were really interested because they're being bothered by this situation, this retailment and availability of alcohol and tobacco situation in their neighborhoods. So it's what's really locally related thing.
Yeah. So we'll definitely follow up more on that. We were a bit pressed for time, and we thought, so let's just recruit those above the age of 18 for this project, and then we explore a little bit further in the future. With the social media, that was also a bit challenging because it was our first time. We actually, 4 people signed up, but only 1 person showed up.
Oh, yeah.
Yeah.
That's another challenge.
Right.
That's a typical challenge, actually, in the scientific process.
And we don't know why. It was a beautiful day, which you can see it as, a beautiful day to do data collection or a beautiful day to do something else. So it could be that. We also got some feedback from the communications department saying that there were lots of clicks, but kind of, but not as many people signed up after viewing the web page. So maybe there was something wrong with the web page. So lots of lessons learned, I would say. But yeah, recruitment can be quite challenging.
And it was a one-day event, our mapping day. Yeah. Maybe in the future it can be an ongoing process.
Right.
With a dedicated team for the training and
Exactly. And it makes you also wonder, if we didn't require half of their Saturday, for example, if it was something else, something lighter, maybe that would also, generate more interest. So lots to think about.
Actually, that's a great point to proceed with my next question, because I was also going to ask you this really cozy term, I would say, Citizen Mapping Day. It seems like a really nice day, but I'm not really sure if it's so pleasant as it sounds. So I would like to ask you maybe going through what happened on that day and how did the information process, the information of the participants go through. And was that fun?
Yeah, we tried to make it fun as possible. Our trainer, Sisai, he's the main geographer, main responsible of this project. He did the training session. And at first, I think a couple of more senior citizen scientists felt a bit afraid, I would say. Maybe a bit strange to comprehend all the trainings and what's going to do. I felt the panic at the beginning. And then they saw that it's not that hard. And when I'm field, everything went great. And they were back with proud, we did really great. And we were able to do the mapping. It was difficult to explain. It was influential at different levels. First, they did something new in their lives. For a day, they learned about OpenStreetMap application, how to do mapping, how to do tagging, and then went on the street, saw the neighborhood, and looked for the retailers on purpose, and then came back and they saw we tracked all the routes they've been walking, and we showed them what they've done. And then, it was really influential at different levels. Yeah.
Actually, I'm pretty sure that you also have changed their perception when they walk on a street. They will also see the vending machines right now and also remember that day maybe.
Yeah, that's what we hope for, right?
That will be also one of the positive results of the project maybe.
Definitely. Yeah. I think one of the citizen scientists, she said, wow, it was unbelievable to see so many tobacco and alcohol retailers right in front of an addiction center.
Yes.
Yeah.
That's so,
Yeah. And also I think
that's so bizarre actually.
Right.
So she said they're doing this rehab and they're out of the building and they saw this shop, like alcohol and tobacco shop. It's really...
Yeah. And I think this also says to how, important it is to involve community members, because we didn't realize that there were around rehab centers, because we didn't know that that was a rehab center. So because she's from the community, I think she's noticed this.
Yes, definitely.
Yeah.
And while we were assigning them to areas, one citizen scientist said, "Oh, this is the worst one."
Yeah. So we gained so much too because they know their neighborhood so well.
Yeah. And one we found in the hospital.
Yes. Yeah.
Vending machines, tobacco vending machine or alcohol, I don't know, inside of the hospital.
Yeah. I actually also don't recall if it was tobacco or alcohol, but there was vending machine in the hospital.
It was surprising,
I would call them really strange results actually, but it's also really enlightening to learn that these vending machines are everywhere. And especially you don't really expect to find them near of the addiction centers. And but moving on to the other results of the project, maybe in general, and also migrant related results with your project. And would you like to start first, Ezgi, about the general results of the project? I know that's work in progress right now, so you don't have all the results right now, but maybe initial results.
As of now, we can say we successfully mapped tobacco and alcohol retailers across Mannheim with the help of citizens. And volunteers covered more than 14 kilometers of streets in a single day. They identified these kiosks, supermarkets, petrol stations, vending machines, many of which do not appear in any official databases before. And we have now a high-resolution ground-level data that simply did not exist before. We can say this. And second, we have a clearer picture of the density of retailers across districts now, their proximity to youth-sensitive areas, and neighborhood level differences linked to socioeconomic status and migration background, maybe gaps where official records are incomplete. We can say this.
Yeah, maybe I'll just add to that. We actually then we simultaneously hired data collectors to collect the rest of Mannheim, because the citizen scientists mapping day was just for 2 hours of data collection, and that wasn't enough to cover all of Mannheim. It took us, the two data collectors, about 3 months actually to cover all of Mannheim. Yeah.
Correct.
And we're in the process of analyzing data now and hopefully have something to share next year.
Hopefully we are also
this
really...
podcast.
That will be great. Yeah, we will be really glad to have you here and also talk about more concrete results actually on this project, and also with the other projects, of course. Yeah, sure.
We would love to. Yeah,
us and them team is so aligning with our division's mission, actually.
I would totally agree with that. And I would also really like to ask you, because you are concentrating on Mannheim, which is a migrant city. I would also call it, as you explained, 40% of the Mannheim's population has a migrant background. So what would be the relationship between your project and also us and them in terms of this migrant-related city, and also in terms of what you found out with the project, actually, as in terms of your results?
I think it's early to talk about this. We don't know the clear picture about the relationship now.
Yeah.
But for the migrant health, it's a topic, access to healthcare systems. So maybe in the future, the division can talk about more of that.
Yeah, we have several projects that are just starting about migrant access to cancer prevention services, because we know that migrants tend to access these services less due to many different issues, such as language, for example, trust in the healthcare system, and things like that. So this type of study is done a lot in other countries like the US and the UK specifically, but in Germany, not as much. And so this is quite an important area that we want to explore further. And I think we would be able to talk to you more about.
Sure, that will be great. Yeah, before concluding our formal part, I'd like to ask two more questions, actually. The first one is a more provoking one, and I would like to ask, citizen science as a methodology, at least in terms of your specific project, was it a success story?
So I will just speak in terms of our project.
Sure.
And I think it was. I mean, even though we didn't recruit that many people, so maybe in that sense, we weren't so successful in recruiting that many people. But I think what we wanted to see was there. So in terms of increasing awareness, in terms of also scientifically testing the feasibility of this approach, I think that was also really helpful to have this pilot. And for our ultimate goal really is to, bridge the gap between evidence and policy, right? So we talked to these citizen scientists who joined us about the dissemination event, and they are very keen on helping us to invite the right people to this dissemination event. So I would say overall, it is a success story. It's something that we will continue to explore. And the part where we didn't get to recruit that many people, we hope to improve on in the future. Yeah, by actually studying probably how to better recruit, how to more effectively recruit citizen scientists.
And also based on your results, actually, and initial results, not only restricting to that project, but also maybe your prior research in this tobacco and alcohol retail, actually, maybe not really restricting ourselves in Mannheim. What would be your general policy recommendations in terms of preventing this alcohol and tobacco consumption? Maybe would you like to start first, Ezgi?
This is one of the objectives of this project, to create this data to show the policymakers that there's this kind of problem here, and to show them the problem. That's the first step, actually. Like we talked before, there's no regulation and licensing, so that we don't have the data, like ground level data. So, and after this first step, showing the data, this is the density and this is a problem, and community things like this. As I think another success of this project is like we found people who are interested in this topic. People are caring about these things. This was another aspect. And having their support and then informing the policymakers, I think it could make a difference in the future.
It's a good point.
Would you like to add maybe another point?
Yeah, sure. So I think actually from these results, so one our postdoc who has sort of background in political science, she's actually going to work on another project where we kind of present a policy brief based on this data to mayors of Heidelberg, Mannheim, and mayors of other cities to find out what would motivate them to, for example, one, ban cigarette vending machines. And I think maybe in the future to recommend a licensing program or,
system,
for tobacco.
regulation.
Exactly, for tobacco and alcohol.
The most low-hanging fruit would be the vending machines, I think.
Sure.
The banning vending machines. It's the only country in Europe, Germany, has vending machines on the streets. I don't know.
There's a few others, like Switzerland, for example. But many countries have banned or restricted vending machines. And now we even find e-cigarettes and snack machines.
Oh, that's another thing. We also mapped the e-cigarette vending machines. Like even the stationery shops sells, bookstores shop e-cigarettes.
So this is also an emerging problem, I would say.
For the protection of youth.
Yeah, totally. And maybe that would be my personal reflection, but I was also really surprised when I came to Germany and see all these cigarette vending machines on the streets. And the first question that came to my mind was actually, okay, how do you prevent it from the minors? Actually, that was my question. But thanks to you today, I feel also myself really informed about this problem, and also thanks for your policy recommendations. And I hope that that would be a really good point that should be taken seriously by the policymakers. And I'd like to continue with the future plans. You already mentioned about these e-cigarette vending machines. That could be also a really great research topic. But maybe as the future plans of your division or your personal research plans, what would you say, Professor? What are your next plans actually ahead?
Great questions. So there's several areas I would say that our division will continue to work on. I think one is, as I was just saying, like this policy brief, these knowledge translation tools to better communicate evidence to policymakers, particularly because since we're a German Cancer Research Center, we're interested in like primary cancer prevention, alcohol, tobacco being very key risk factors. So working in that area, continue to generate data for those policy areas that were lacking data. And we will like to continue to involve scientists in this aspect too, to create more awareness, I think, about this important issue. And another area, like I was saying, is the migrant and access to cancer prevention services, like screenings, for example. And additionally, other types of underserved groups. Yeah.
Yeah, we'll be really glad to talk about the next projects, future projects of yours, because it's also really aligning with our overarching team, us and them. And yeah, thank you so much for the information. And you also answered my actual second question that maybe you'd like to elaborate more on. Would you be willing to include citizen science in your future projects as a methodology, maybe?
Absolutely. Yeah, absolutely. And we hope to do it better next time. So.
That's a learning process.
Yes, it's definitely a learning process.
The first round.
Sure. But I have this impression that you were always successful with using this methodology actually in your research.
With this limited time, limited stuff, I think we did great.
I think so too.
That's great. And also, I have one personal question to Ezgi, because we have recently learned that Ezgi will pursue her career outside of Heidelberg, actually. And we are really sorry to lose her in Heidelberg as a great researcher. So I'd like to ask first, what are you going to miss most in Heidelberg? And maybe as a follow-up question, you can also combine them, melt them into the same pot. What experiences are you going to take with you into your future career from the University of Heidelberg, from the German Cancer Research Center, from your division?
So hard times for me and some emotional questions. So I try to keep my tears. I will miss most about Heidelberg, the first nature and the peace and silence and mountains and the Neckar. I'm gonna definitely miss the city. Then I will miss being a part of this international community. It was really an amazing experience and time for me. Here, seeing all these different aspects of humanity and also being human as a giant shared experience. We have so much in common. So I will miss this. And I will miss this safe space, like the city and Connie gave me to discover my interests in different projects and challenge myself. Speaking of that, I will definitely miss the constant push to grow academically, personally, professionally. I think Heidelberg is a great place for this growth. Yeah. I will miss, of course, my Turkish community here. So different. So being a migrant feels so different. Yeah. It's been 4 years now, and I'm definitely built a great foundation here with my master's and after my work experience here. So I will take from the Heidelberg University of work experience in DKFZ. I will take my confidence actually that I built here, challenging all those challenges for the new academic culture, learning a new language, starting over in a new country. It was really challenging. But it gave me a great confidence. So I will bring this. I think, I take this.
Actually, I can also sincerely say that we'll miss you in Heidelberg, both as a wonderful person and also a really great researcher. Maybe, Professor, would you like to add something?
I completely agree. Ezgi, you've been amazing and we will definitely miss you. But I know that we will still keep in touch because we talked about working on grants together already.
Yeah.
We will also put you under pressure to return to Heidelberg.
Yeah, maybe one day. And I'm going back to Turkey now, Turkey, as a new name. I'm planning to work at a university. Like I will be working again with community and families and children. So actually, I'm gonna take the implementation research aspect I have learned here to make an impact, because it feels really great to make this communication and bridging the gap between evidence and the community.
We cannot also wait to learn more about your next research projects and also read about them, also talk about them. Yeah. Thank you, both of you, for this wonderful, insightful interview and also taking your time and coming here to share your experiences, your research with us. So with that comment, actually, we are closing our podcast episode today, and we would like to see you in our next episodes. So thank you so much and bye.
Thank you so much.
Ciao.